Hello, everybody. I'm Chelsea King, and I am the Executive Director of the Oregon Health and Education Collaborative. And I am happy to be here today with Kim Scott, who is an outgoing board member of OHEC. And many of you who are watching this probably already know Kim Scott and don't need me to introduce him. But for anybody who is learning of him for the first time, he spent many years, I believe decades, as the CEO of Trillium Family Services, which is Oregon's leading provider of mental and behavioral health care for children and families. And he just has a lot to offer in the way of building community resilience. And I'm really thankful to have you here with me, Kim.
Oh, it's great being here with you, Chelsea. I appreciate the opportunity to get to join you here from the beautiful Long Beach Peninsula, starting my retirement after all those years of working with Trillium. So thank you for the opportunity. I really appreciate it.
Yeah, you bet. How nice to, on a Monday morning, just be out at the beach instead of in an office somewhere. So glad that you get to do that.
The thing that again drew me to OHAC is one, this idea, this confluence thinking, and the kind of the eradication of silos and stuff. But I think the other thing is this is a time to partner, to collaborate, to build capacity through collaborations. This is not a go it alone time. And yet, so many of our not-for-profits, we're individual organizations with individual boards. We're viewed as individual businesses. And sometimes our focus on are we being successful or not is kind of it's almost contingent on, how well are we delivering a particular service, a historical program that we provided, and really maybe one of the measures that hasn't been in place and it has to be in the future is, are those programs and services even relevant anymore in terms of what communities and families need? So again, an opportunity during this time is, how do we build um, capacity, resources through collaboration, new learnings and ways that are relevant to all communities? And I don't think that means that we're necessarily partnering with like agencies or like programs and services. And there's that kind of, I would say, directional learning. You certainly grow that way. But I think it's a time for, looking at intersections. So what is the intersection with things like, care and technology and, new learnings and ways that help us grow? And I think that's part of the potential of these community designed solutions that you folks are looking at through OHEC. I think that's where some of the possibilities lie in terms of developing a system that actually best supports children, families, and communities.
I'm wondering if you could speak to the Upstream initiative. And just by way of introducing it for anybody who's watching this that doesn't know about it, this is OHEC's flagship effort. It won't be our only effort, but it's really what we're leading with right now. And it's the whole idea of that everything we've been talking about with that cross-sector collaboration and the community resilience and addressing ACEs and doing all of this with a really targeted focus on that first 1,000 days of life, prenatal to age 2 or 3. And I'm wondering if you can address what you know to be true about that formative stage of the new human, but also of the family, and just speak to why would Upstream initiative be important right now?
Gosh, in my own life, I'm thinking back when, our first kid and my wife and I had both worked in the field, and along comes our little baby daughter. And I just realized, gosh, I had to take training and all this to be able to drive a car and all those kinds of things. But being a parent, all of a sudden, you're just kind of, you're forced into this role. I mean, you obviously want to be in this role, but in terms of like prior skills, experience, training, etc., supports, there's not a lot there. And then if I think about the bulk of my career, it's really working with systems and families and individuals where those supports weren't in place. And that over time, trauma on top of trauma or whatever's happening in people's lives, it's more than they can bear. And by then, so much of of damage has already occurred. And I think, certainly people are resilient, and we've had, outcomes. There's all kinds of possibilities for how people work through those issues. But what would it mean for us from the very beginning to connect with a young family and to help provide kind of that support? Making sure that everybody is healthy and that they're getting the attention that they deserve, they need to be successful, and focusing on that and learning more about, what are the best supports in that kind of environment. And I can't help but think that if we focus so much more on that, we would see less and less of really my 45-year career of intervening in a process that's pretty far down the path. I think that if we get to that earlier, in ways that it's not an intervention as much as it is that human beings need connection, they need support systems, and how do we kind of build that kind of a service fabric? We certainly have the other. Now let's really focus on building this in ways that support kids in natural settings like their homes, their communities, and their schools, and in supporting families as well.
I love the metaphor of the service fabric and it living, in the neighborhood and in the schools and in the communities. That's a very nice image.